And I think of them as the good guys, and my mnemonic for it is, "Aye, lads." If you've got Lyme, you want the aye, lads. You want the Irish folks helping you here, although they're not Irish. The Infectious Disease Society of America, the United States, has guidelines that are for much lower doses, much shorter treatments, and in my experience, much less good outcomes. And they don't recommend or have as much of a tolerance for the complementary approaches of herbal medicine or energy healing, other approaches. So everything that I brought printed out is available on that website, ilads.org. There's also some good books that are out. Some of them are big and hard. Why Can't I Get Better? This is by Dr. Horowitz. He's one of the people who's I use as a baseline of what I'm doing. The Top 10 Lyme Disease Treatments has a wide range of treatments, including herbal approaches and Rife machines and other modalities. The Healing Lyme is an herbal approach by Stephen Bruner, also has been useful. And I've put on the sheet of resources 3 places that I know you can go and get treatment. Dr. Horowitz's clinic is the Hudson Valley Healing Arts Center in Hyde Park. He no longer takes insurance because insurance companies and pharmaceutical companies went after him because he was using such high doses at longer treatment intervals, and they didn't want him proposing that as a standard treatment. They wouldn't cover it, and they actually went after him. So he no longer takes insurance. If you're able to pay, he would be my first choice. If you're not able to go there, the other clinicians that I listed there do take insurance and can get even fairly intensive courses of antibiotics covered by various insurance approaches. I also put an herbalist on there who does treatment from Vermont over the phone at what is the least expensive approach that I've encountered. That's Tim Scott in Brattleboro. And I included some Jinshin-Jitsu practitioners in the area. So,
who's the practitioner in Hyde Park?
That is Richard Horowitz. I didn't put his name on here because he doesn't list it on his materials anymore. I'm not sure you can get in to see him, but you can, at the Hudson Valley Healing Arts Center, they would be using the approach that he puts out here. So I'm going to ask Eric to step up, and we'll get a little bit more information on the table, and then we'll talk together.
When you're taking the tip off, if you don't have a method that you have on hand, if you take a razor blade or a sharp knife and cut its mouth off, then you leave the head in there, but none of the junk gets in there. And then you can dig it out. Yes, it's an alcohol.
If you're out camping and don't have tweezers or a tick remover, that sounds like a good approach. It's got the right kind of understanding of what we're trying to accomplish.
Does ILADS have a list of doctors in the area if we can't see these 2 doctors?
Yes, on their website.
Hi, my name is Eric Tischler. I'm an acupuncture physician here locally. We own Woodstock Integrative Health, and we treat a number of Lyme disease patients. And I moved back here from Florida about 5 years ago. I grew up here, and I never remembered as much of an infestation with Lyme disease as I've seen since I've moved back here. And obviously in Florida, I didn't see the amount of patients that I see here that are coming in on the latter stages of Lyme disease and with all kinds of co-infections that we see here. And she touched really well on the use of antibiotics and what they can do to a patient, which they can help them severely to help them get over the Lyme, but what it can do to the body over time, and even a short time, it can begin to destroy our gut bacteria. And we need our gut bacteria. We need our bacteria to help fight infections and a myriad of other things, all kinds of diseases and pathogens that invade our system. And the antibiotics essentially destroy that, as well as our diet. We get it from meat, if we eat meat, and many other things. And our intestines host about 1 trillion or more different microorganisms. And there are bacteria that have kind of evolved to create this symbiotic relationship in our intestines. It's a harmony. And the antibiotics, even though they help, they can destroy it. And so oftentimes I see people come in after they've had the antibiotics, or after 3 months or a month or even a week, and they're broken down, they're weak, they have anxiety from the Lyme, from the antibiotics, they have weak digestion, they have poor memory, they have a host of many different symptoms that, that we see. And so I want to talk about supporting the body with the use of Western medicine, and how we can do that with other things, through diet, through exercise. We incorporate an infrared sauna. We do some detox therapies. We use homeopathy is the main thing to treat Lyme disease. And I want to be clear, we don't diagnose Lyme disease, but we do treat various stages and forms and co-infections of Lyme. And what we've done recently, we have 61 different frequencies of Lyme homeopathically, and we can do through something called kinesiology, applied kinesiology, or muscle testing, to find out which one is affecting a particular individual. And with that, we can then make a specific homeopathic remedy to antidote, or help to, I guess through like cures like, in some way give that frequency to the person to help fight the infection. And we've been doing that now for this particular homeopathic treatments for a few months, and I've had some great success with it. And with that said, there are many other things that can be done to help to support the body and to help heal. And you know, Western medicine is one of them. Diet is a big one. We work with a lot of people with diet. Many people don't realize that food can exacerbate your symptoms. Food can cause more inflammation. People don't know what to eat, or what routes to go on as far as what to avoid and what not to do. And there is information out there to help people with this. One of the things that she also touched on that through my research I found is the Lyme. For me, in Chinese medicine, it's categorized into two categories, into the brain and the digestive system, into the nervous system and more digestive. And with the brain, I see a lot of people coming in where it's eating away at the brain, and it's actually mimicking syphilis and some of those symptoms. And that's scary, because people are coming in with symptoms of dementia and Alzheimer's, and they think they may have that, but it's actually the Lyme that's causing it. And so through rebuilding, through supporting, and through, I guess, just helping them find a balance and feel like they're not going crazy, because that's what people that I see with this are going through. They feel like there's no answers out there, and oftentimes we're the last people that they come to for help. And it's challenging, but there is hope out there for people suffering from this, to help to get better and help to rebuild their systems, and mainly their immune systems, because that's what's destroyed through the antibiotic use. The immune systems get weakened, and they're more susceptible to other illnesses and diseases. So I'm not as versed on the Lyme as both of these ladies are, but I have had a lot of experience in helping people to get better and feel better, and get through this through various modalities that we use at our center. Any questions about what? Oh, go ahead.
Yeah, I just found out, I have Lyme disease, if I have to continuously argue with my PCP about it. But one question that comes to mind is, how can you tell if it's gone? Let's say my body fought it off and I really succeeded in getting rid of it during this fever and headache. Is there a way to tell it's gone?
One of the things that we would do is to do the applied kinesiology through the muscle testing. and keep testing until that test's strong, until that frequency that you tested weight for stays strong. And with that said, your symptoms would probably begin to improve, and you begin to feel better.
Could I also
Sure,
offer a response to that? One of the patients that I treated was a young man in his 20s who had come from Lime, Connecticut, and had a swollen joint when he was a young teenager, and was diagnosed, one of the first patients diagnosed with Lyme disease in Lime, Connecticut. He was treated at that time with a pretty intensive course of antibiotics, and his swollen knee, which was his only main symptom, went away. And he had been fine for over a decade before he came here. He came to this area, and his knee, the same knee, swelled back up. And he went to the emergency room, and they gave him 200 milligrams of doxycycline a day for 30 days, which is what the CDC recommends. And he actually started getting quite a bit better. The swelling in his knee went down, and he was feeling like the antibiotics were helping him. So he went back to the emergency room as he was finishing the course and said, "This is great, I'm better but not completely better, can I have some more antibiotics?" And they said no. Because that's not the recommended therapy, and there's no evidence in the research, in the literature, showing that more 200 milligrams a day will help you. So he went to a local Jinshin-jitsu practitioner that he knew and told them the story, and that person sent him to me. And I said, well, you know, my inclination is when something is working that you continue it, but I'd like you to take a little bit more of the doxycycline, and I'd like you to plan to be on it until you've been symptom-free for a month, and then go one more month. The idea being, like with anything, you finish the antibiotic course, you may still have a few of the bacteria. So he also got nutritional therapy and did Jinshin-jitsu during this time. And I gave him 2 different antibiotics because he could tell when he thought the organism was in his bloodstream. And his knee swelling went away completely, and he said, but I still feel like it's in me. So I said, all right, let's try getting it out of me. So we gave him more antibiotics. He continued with his nutritional therapy. He ended up with about a 4 or 5 month course of antibiotics, was skipping rope and riding his bicycle, and is now another several years out with no symptoms. Is he cured? I don't know. Could he go another 10 years? I'd be happy with that, and I think he would be too. And now we know what he would need if he did come back later. So this is an organism that can hide itself within the connective tissue very easily. And so that's one of the reasons that, especially if you've ever had this, I think it's really important that you do all the things that we recommend to everybody. You know, the right kind of diet.
Can it go dormant? Can it go dormant in the body and then resurface?
Certainly in this young man,
yeah.
It did. I mean, he would have told you he was cured of Lyme from when he had it when he was a teenager, and it was over a decade later that he came back.
When that happens, that you get this bacteria can get into a protective shell. I forgot what that's called.
The microfilm?
Biofilm?
Biofilm, right. But there are certain herbal things,
Yes,
some
that can go
Chinese
through
and
the
some
barrier.
others, that can dissolve the biofilm.
Yes.
So that the antibiotics can get to it.
Yes.
So I guess you have to do a hand in glove thing.
There definitely should be a
Biofilm.
Eastern and Western approach with this,
Dissolve
because
the biofilm.
they both have their place, and there's so much that's unknown out there about this disease that I think people think they have a hand on out there, because people's symptoms might disappear, but then they eventually come back, and it's not that they got Lyme again. It's, in my opinion, it's that things went dormant and then they resurfaced. Like Epstein-Barr, chronic fatigue, things like that, they can stay dormant in the body and then resurface. So it's more about what we don't know about this disease, and trying to learn more about how we can get through, like you said, that barrier, and help people on a deeper level, more permanently. Yeah.
So are you recommending that people take herbal remedies along with the doxycycline, along with the Western medicine, or wait out the course of the Western medicine and then do that? What is
We-
it?
You want to go first, and
I
we
would
may
say,
differ on that.
in my opinion, I would say go yes with the Western medicine. I love the approaches. If someone can handle it, the amount of milligrams of the doxycycline, and then seek treatment Western-wise, or toward the end of it, which is I see a lot of patients at toward the end, depending on how
herbals,
long with the herbals. Yes, yeah.
Yeah, I tend to go by what patients tell me is going to work for them, because people know themselves. So there are people who do not like Western medicines. And if they want to start with an herbal approach, then I say, go do that. But I can't do that for them because I didn't train in that, don't have the experience to do it. I do think that the allopathic approach, Western medicines, doxycycline, and the other antibiotics we use, can be very effective, especially early on, if we know we're early on. And so I recommend that. But then I like to have the nutritional support, I like to have gut support, at least probiotics, and if somebody has something else that they think they can offer and the person wants it. I don't think it will interfere with the antibiotic approach. And I asked this gentleman to wait before,
Yeah.
now we're taking other questions first.
Is the bullseye only Lyme disease? Because in 1986 and 1987, I lived in Nicaragua in the mountains, and we bathed in the rivers, and the rivers were not really clean. People bathed in the river, but it was dirty water sometimes, but there was nothing else. And on my leg, I got a big bullseye. Really, obviously, and big. And I just we had some iodine, I put iodine on it till it went away. And I don't know, that's 1986, 1987. And the only thing that happened that I developed
Tendinitis or synovitis?
It's called trigger finger.
Mm-hmm.
And sometimes my hands hurt a lot. But otherwise, I don't know, maybe it wasn't Lyme disease. Maybe it was some other bug. So the question is the bullseye unique to Lyme disease?
My feeling is it is not. It's a particular type of immune response at the site of the organism's entry into the body. And not even all patients with Lyme have it. 50% roughly will have some kind of rash, and it's not always a bullseye rash. There are bullseye rash described in the medical literature before we had Lyme in our conversation. But it's not clear to me where in the world these organisms are and how long ago they were. So it is possible that it is that organism, it's possible it's some other organism, and I wouldn't treat you for it unless you had something else happening now that suggested that you had an ongoing infectious agent. And then I might be a little suspicious for an organism like this, because organisms like this, even if they're not the Lyme organism, might still respond to the same kind of antibiotics and same kind of approach.
And then the tick, it's a really small tick, because my cats get ticks that are, I think, a little bigger.
There are different types.
Sometimes they get on my bed, and one night I woke up and I had a tick, but it was...
These are the little tiny ticks, what we call dog ticks, which also would be on a cat, that are the bigger ticks.
Yeah.
Don't have the same intestinal system and don't harbor this bacterium in the same way. So they can have some other stuff in them, but they're not as bad. It tends to be more a local reaction at the site, and if you do good cleaning, if it's a dog-sized tick, then you don't have to be worried about these organisms.
Yeah. So Lyme is a really tiny...
It's a very small tick that's about the size of a it was said grain of sand. It's a little bigger than a grain of sand, but almost that small.
No, I haven't
Is
seen
that the tick or the root?
Well, I can't distinguish. I don't have enough of an entomologist to be able to distinguish whether it's the nymph or the tick. But if it's small like that and it's got its head sunk in, I consider it a tick for these purposes.
Yeah.
In the back, yeah.
Yes, Kathy Nolan, I want to thank you for all the great work you're doing on the trails, which is very fitting to the topic of Lyme disease and deer-borne ticks. This is my very quick question. The symptoms of inflamed societal joints over reactionary homeland security swelling is caused by Bush-Anoia type U.S. war propaganda, and according to my view, is not anything like the symptoms exhibited by ticks, even though tick is within the word politic. Would you agree?